name is Jody. I'm a registered nursing student at Northwestern, and I'm gonna be a member of your care team today.
Okay.
All right, so what I'm here for is to do a short head-to-toe assessment, okay? Before we get started, let me check your band.
Okay.
All right, and can you state your full name for me?
Lenny Sherrard,
And your date of birth?
9/25/85.
All right, perfect. And do you need to go potty before we?
No, I don't. Thank you.
All right, and can I call you Lenny? Is that okay?
Yes, thank you for asking.
Oh, you're welcome. All right, so we're going to start with your head. We're going to look at the cranial nerves. So we're going to do eyes, nose, mouth, ears, and then we'll move through to your lungs, your heart, your abdomen, your legs, your arms. And if any time during the assessment, if you have any questions, just stop me and ask, okay? All right, so do you know where you are?
Hospital.
And do you know what hospital?
Roar Hospital.
All right, and what season is it?
Fall.
All right, good. And so you're awake, you're alert, and you're oriented, so that is good. So
Okay.
AAO times 4.
Okay, that
All
sounds
right.
like good news. So I'll
It is,
take
it is
I'll
good
take it.
news, it is. Okay, so what are you in here for?
Just really bad nausea that won't abate, and it just won't go away. So
Okay, all right, so how long has it lasted?
about 3 days.
Okay, 3 days. All right, that's a long time to be nauseous.
Right.
All right, has it affected your bowel movements or?
Yeah, I don't know when I had my last one. I usually have several, and nothing today, or I don't think yesterday either.
Okay, all right, and so that is not normal for
No.
you.
Mm-mm.
What about urinary frequency? Is it more, is it less?
It's less.
Any burning whenever you pee?
Mm-mm.
You're not getting up in the middle of the night to go to the bathroom either?
No, I'm good.
Okay, all right, okay, so that, what we're gonna do this assessment. I'm sure we're gonna run some tests. I'll keep you posted throughout the day and let you know what's going on, okay? I'm just gonna grab my gloves real quick.
Okay.
Now, while I'm putting this glove on, let me go ahead and take a look at your eyes. If you could just look at me. I'm just checking for ptosis, which is eye droop.
Oh.
Okay, all right. Now, I'm gonna go ahead and raise your bed up. Just so I'm not bending over you.
Okay.
I'm so sorry. I will put you back and make sure that you're comfortable before I
Oh,
leave your
this is
room.
fine.
Because it looks like you had it all situated, and it's kind of like whenever you get in your car and you have your seat adjusted the way you want it and somebody else moves it and you have to go and readjust it again.
I know all about that.
Okay, so like I said, I'm gonna check your eyes first, okay?
Okay.
All right, so I want you to focus on the back wall over here.
Okay.
All right. Okay. All right, and again, stay focusing on that wall. Okay. All right. Now I'm going to move my pen light.
Okay.
I want you to just focus on the tip, but try not to move your head.
Okay.
Okay, good. All right. So your pupils are round, equal, reactive to light, and accommodation.
Is that good news?
That is good
Okay,
news.
all right.
That
Thank
means
you.
that they did exactly what they were supposed to do.
Okay, good to
Okay?
know. Thank you.
You're welcome. All right, so the next thing I'm gonna do is I'm going to check, I'm gonna press on your shoulders. I just need you to shrug up against my hands, okay? All right, very good. Now I'm gonna put the back of my hand on the side of your face and just try to push against it. Good. Now this one. All right, very good. Okay, and now if you don't mind removing, like just pulling down your mask for me. Okay, now I'm going to check your mouth. Just open your mouth. All right, so mucous membranes are pink and moist. That's great. All right, now we're gonna do it again, and this time I need you to say ah.
Okay.
All right, okay, so your uvula went up and down exactly like it was supposed to.
Okay.
And I didn't see any sores. Your teeth look like they're very well maintained, so that is great.
Okay.
All of that is good. So the next thing we're gonna do is check your nose, okay? So I need you to close your eyes. I'm gonna place a cup under your nose, and when I say when, just take a little breath and tell me what you smell. Okay, go ahead. Do you smell anything?
Oh, mint, I'm sorry.
That's okay. That's very good. It was mouthwash, so you did good.
All right.
Okay, all right, and you haven't asked me to repeat anything, so you're hearing me okay?
Yes, yes, ma'am.
All right, good deal. All right, now I'm going to go ahead and listen to your lung sounds.
Okay.
Okay?
Should I just,
And you can just sit back and relax. You want me to put your bed up a little bit more?
oh, no, it's fine.
Okay. All right. So I need you to breathe through your mouth. Okay. So just take a deep breath in and out as I move my stethoscope. And actually, let me clean this off real quick
Okay, thank you.
before I touch you with it. Okay. Okay. I'm gonna check the corner. Check the base of your rib cage. Okay. All right, now you're doing so good. I want you to give yourself a big hug for doing so good. And bring your chin to your chest and just lean up for me just a little bit.
Okay.
And again, just deep breaths through your mouth. Okay, all right. Now, if you had been an older person, I would have started at the base and worked my way up.
Okay.
But with you, don't have to worry about that. All right, so your breath sounds were clear, they were even and unlabored, so that is good.
Okay,
There was
great
no
news.
crackles, pops, or wheezes.
Thank
Okay?
you.
Oh, you're welcome. Okay? All right, now, the next thing I'm gonna do is listen to your heart.
Okay.
Okay, so aortic, pulmonic, Erb's point, tricuspid, and mitral. And I'm sorry, excuse me, this one's just a little bit further up. Okay, all right. So the heart sounds good. I was able to hear the lub dub, the S1 and the S2 sound, so that's good.
Okay, great.
All right, all right. So the next thing I'm gonna do is ask you to squeeze 2 fingers.
Okay.
All right. Now give me a soft high five. All right, and resist my. There you go. Good job. All right. Now I'm going to lay your bed back, and we're gonna go over your stomach
Okay.
and your extremities. Okay. And I'm also gonna listen to your back.
Okay.
So for this, I have to lay you flat. You're doing great. Thank you so much for your patience.
I might take a little nap.
That's fine. This part, look, the hard part is over. Now you can just relax and, okay, good, okay? All right, now, the first thing I'm going to do is assess your abdomen. So I'm looking for any bruises, abrasions, scars, that sort of thing. I'm also checking the temperature. I'm checking for moisture. Okay, I'm also looking at the shape of your stomach, just making sure that everything looks good there. I'm gonna check your umbilicus, which is your belly button, to see if it's inverted or everted. And then after I listen to your bowel sounds, then I'm going to check for hernias as well. okay? So I'm gonna listen to your vowel sounds now.
Okay.
And I should be hearing 5 to 35 per minute.
Okay.
So I'm gonna start in the lower right quadrant. I'm gonna move up to the upper right quadrant, then the left upper right quadrant, and then the lower left quadrant. Okay, all right, and the vowel sounds sound good, so that's good. All right, now the next thing I'm going to do is palpate your abdomen, and what that's for is to check for tenderness. Also kind of helps me with the temperature as well. I'm going to make sure that there isn't any knots, any pulsations, or anything for concern as far as any of that. So if you feel any tenderness, please just let me know, okay? Okay, you good?
Mm-hmm.
All right, so now this time I'm going to do that again, but just a little bit deeper. Okay, all right, now, so that looks good. Now, normally I'm sure you've seen on the movies or on the TV shows where they go around like this.
Mm-hmm.
We don't have to do that. That is called percussion, and basically you're listening for timpani, which is like like a drum. You listen for the echo.
Okay.
So just FYI, in case you're ever on Cash Cab, isn't that show?
Yes.
All right, so the next thing we're gonna do is I'm gonna check your arms.
Okay.
And I'm just checking to make sure that they are symmetrical, which they look like they are. All right, and you can relax, it's okay. I'm gonna check the temperature. I'm also checking for any abrasions. I'm checking for edema. I'm checking to see if there's any bruising or anything like that that we need to be concerned about.
Okay.
So I've checked for the temperature. Now I'm gonna give you a pinch, that's for skin turn, and a poke. That's for edema. I'm also going to go ahead and go down your arm. And the same thing on this one. There's the pinch and poke. All right. And now I'm going to check your radial pulses. Okay, and those are equal bilaterally +2. So that's good.
Okay.
All right. All right, and now we are going to check your cap refills. All I'm going to do is squeeze your fingernails. This is just to check for dehydration. All right, and they seem to be refilling. They're refilling in less than 2 seconds, which is great. So that's
Okay.
good. Considering the nausea and the lack of eating and everything, you're not dehydrated, so that's good.
Okay.
Okay? All right, so now I'm going to move down to your legs. Again, checking for temperature. Okay, we're going to do the pinch and the poke. Okay, I'm also going to check your pedal pulse. Okay, now bring your toes towards your nose. There you go. Now step on the gas. All right, very good. All right, and I would check the cap refills on your toes as well. I would also check to make sure that the toenails, none of them are inflamed. I would look at the back of the heel and just make sure that there weren't any pressure sores or anything there.
Okay.
But that all looks good.
Okay.
Okay?
Yeah.
All right, now can you roll over on your side?
I think just a little bit of help.
Okay, why don't you just cross your arms for me and then I'll do it, okay? So I'm gonna grab your shoulder, I'm gonna grab you at your hips, and I'm just gonna pull you towards me. You good?
Mm-hmm.
All right, now for this, what I'm doing is I'm checking the back of your head, your neck, your scapulas, down your vertebrae, your coccyx, the back of your legs, and your heels again, just for pressure points, just to make sure that there isn't any bruising or red spots on you. But it looks good, so I think you're good with that. All right, and that's it. We're done with that part. Can I roll you back over?
Yes.
Okay, you're welcome. Okay, all right, now I'm gonna check your medicine. Just wanna make sure that it's the right medicine. I'm gonna follow your tubes from the wall all the way down your arm to make sure that everything is right. That looks good, nothing has expired. You've still got what you're supposed to have left in there, so that's good. Do you have any questions for me?
No, I think I'm good. Thank you so much.
You're welcome. Do you need to go to the restroom?
No, thank
Okay.
you.
All right, so your call bell is here.
Okay.
Please do not hesitate to call us if you need anything,
Mhm.
okay? And the doctor should be in a little bit to check on you, and then I'll be in to bring you your medications.
Okay.
Okay,
All
and
right,
on my
thank you
way
so
out,
much.
I'm going to check and make sure there's nothing you can trip on or fall over, okay?
Thank you.
And I told you that I would get you back with that comfy physician before I left. So do you want to set up or do you want?
Yes, please.
Okay, all right. So I'm gonna raise the back of your bed up. I'm also gonna lower it so that if you do need to get out, you won't have a hard time.
Oh, thank you.